Hi, I'm Tyler Burns, and this is my physical assessment for nursing 641. I've already washed my hands, I've gathered my equipment, and I've explained to her that we're going to be doing a full assessment of all the different body systems. Some parts of it is sitting, some's lying down. Told her it might take some time, so she went ahead and used the bathroom before we started, so that wouldn't be an issue. So I'm going to start off by introducing my patient. Can you tell me your first and last name?
KVAN,
And what is your date of birth?
12 to 90,
Can you tell me where you're at right now?
Madisonville, Kentucky,
And what year is it?
2017.
Okay. So then I'm going to have her look at these 5 items on this card.
Okay.
Can you tell me what those are?
Cat, house, dog, flower, truck.
All right. And try to remember those.
Okay.
Then I'm going to have you. Can you tell me what your mother's maiden name is?
Lewis.
Okay. And if you were in a burning building, what would you do?
Get out and call 911.
All right, perfect. So by that, we can tell that her judgment is appropriate. Her remote memory is intact by knowing her mother's maiden name. As you can tell by her affect, it's just a normal affect. Speech was clear. Whenever I noticed her walking in today, her gait was steady. No issues with balance or coordination there. Dressed appropriately. She's clean. No hygienic issues there. So we're gonna go ahead and move on to the head to toe, the actual head to toe assessment. So first we can look at the symmetry of her head and face. Facial features seem symmetrical. So go ahead. Head appears to be normal cephalic. Go ahead and palpate her skull. There's no indentions or anything like that. Any pain at all?
Mm-mm.
Okay. So you can tell her figure, like I said before, configuration skull is normal. Her skull is normal cephalic. No issues with no abnormalities upon palpitation of her head and skull. So we'll go into her eyes. Can you close your eyes for me? Her eyelids, no redness, irritation, no apparent lesions, no swelling, anything like that. Her eyelashes appear to be evenly distributed. No drainage or anything on those. Can you open your eyes back up for me? Okay. Scleria is white, no apparent jaundice or redness. Conjunctiva, pull your eyes down a little bit. A little pink, red, no issues there, no draining. So those look fine. We'll go to our lacrimal gland. So I'm gonna press on this. Tell me if you have any pain with this.
No.
No apparent enlargement, nothing like that. So we'll check her near vision. I don't actually have a Rosenbaum chart, but we'll pretend like this is one. I would have her hold it 14 inches away from her face and read to the smallest line she can. Then we'll go on to the check. Use my pen light, check for perla. So I'll have you look at me. Okay, her eyes appropriately constrict to light. Going from about a 3 to 2. I'm going to check for accommodation as well. Can you follow my finger? Okay, and I'm going to look at my finger. I'll look at the wall and back my finger. Her eyes seem to accommodate appropriately. No issues there. So we'll go on to the red reflex. I would take my ophthalmoscope. I would cover my left eye, looking at my right eye into her left eye, the same eye right across from me, looking for any red. Do the same on the other side. Looking, hopefully, seeing the red reflex. Then I'm going to go to her ear. I'm going to palpate her pinna, her mastoid, and then her tragus. Any pain? There's no swelling or anything noticed there. Then I'll take the otoscope, resting my hand on her head, holding it upside down, point her ear up and back, looking at her ear canal, looking for any debris or any irritation of the ear canal, then looking at her tympanic membrane, hopefully finding a pearly gray with the cone of light present and all the landmarks present. I would check in both ears. Then I'll perform the whisper test. So I would have her plug one ear for me, and then I would stand about 2 to 3 feet behind her, and whisper just 5 letters or numbers. So
75 CTB.
okay. then I would have her clip the other ear stand the same distance away from her other ear, and use 5 different letters to have her repeat those. So now we'll go on to her nose. Her nose appears symmetrical. I'm going to go ahead and palpate her sinuses. So we have her frontal sinus. Any pain there?
No.
We have her maxillary sinus. You have any pain with that?
No.
Okay, we're going to check for patency of her nostrils. Can you close one nostril and breathe for me? Do the other. Nose appears to be patent with no sign of congestion or anything. So now I'm going to assess her inner nose. Can you look up for me? So hold the nose up. Check in there. The nasal mucosa appears to be pink, moist, intact. No issues there. Our septums, there's no signs of deviation or perforation. Turbinates are present. And so everything looks good up there. After that, we'll do her mouth. So looking at her lips, you see they're smooth, red, no dryness, or anything, no lesions or anything at all. Can you open her mouth for me? So I'm gonna look at her buccal mucosa, and it appears to be like a pink, moist, intact. No lesions or issues there. Teeth, no obvious, no caries, no cracked, broken teeth, no missing teeth. A tongue appears to be moist, no issues there, no lesions. Can you raise your tongue for me? No, yeah, no issues or lesions, bumps on her tongue. Look up at her hard and soft palate. See no abnormalities there. Looking at her posterior pharynx, the smooth, moist, no abnormalities there at all. And can you, I'm gonna look at your gums real quick. Gums don't appear to be reddened or anything, or any issues with that. Sorry. So after that, we'll move on to can you try to swallow for me? Okay, if I had some water, I'd actually have her try to swallow some water. Then we'll go to, we'll listen for bruise in your neck. After I palpate them, of course. Palpate your carotid artery. Okay. Alright, perfect. So I want to use the bell. Alright. Alright. So no apparent bruise. I would then look for JVD if I had the proper equipment. I could lean her back to 45 degrees. Have her look away, looking for any kind of jugular vein distension in her neck. Do the same to the other side. I'll then look at her tracheal position. It appears to be midline. So now I'm going to feel for her lymph nodes. So I'm going to look for the preauricular, postauricular, the occipital, and tell me if you have any pain with any of these. Then we'll go to the superficial cervical, or posterior cervical, and we'll do your deep cervical, and the suprascapular. Any pain or issues there? Tonsillar, submaxillary, and submental. Any pain there? Okay. So no enlargement, no pain on that. So then we're going to check for her thyroid enlargement. So I'd stand behind her, giving her some water to sip on. Use 3 fingers here, just feeling. Have her swallow for me. And swallow again. Alright, no apparent enlargement with upper thyroid. So I'll move on to the skin of her upper extremities. Looking for any lesions, feeling for any bumps or lesions at all. Skin appears to be dry and intact. No redness, no abnormalities at all. So we'll go on looking at her finger. If her nails were pain, I could check cap refill. Um, Looking at the nail bed angles, it doesn't look like there's any sign of clubbing or issues with that. So I'm gonna check her pulses now. Checking her radial pulse. ARA 2 plus bilaterally, and then we'll check her brachial pulse. Also equal and 2 plus bilaterally. Then we'll check for her epitrochlear nodes in both arms. Any tenderness there? No signs of enlargement at all. Move to the other one. Any tenderness there? No signs of enlargement or anything. Now I have you turn around. We'll do the back. So this we're looking at her posterior chest. Her AP diameter appears to be a normal ratio. Um, we'd look at the skin on her back, look for anything, any kind of lesions there. With her shirt, we would normally have her shirt removed. Looking at that. Now we're going to go ahead and palpate the bony prominences. Can you tell me if you have any pain with any of this? Any pain at all?
Nope.
Alright, so we're going to go to the paravertebral muscles. Any pain with that? Good. Now we're going to look at chest excursion. Oh, we're going to the 10th rib. And can you take a deep breath for me? Alright, her chest appears to expand equally bilaterally, so that's good. Next we're going to listen for resonance. So I'm going to just lightly tap on your back some, okay? I'm going to go between the shoulder blade and the vertebrae. So sounds over both lung fields, sounds resonance. So that's a normal sign. We'll go to just auscultating her breath sounds posteriorly with the diaphragm. Okay, have it just breathe normally for me. Okay, so her lungs sound clear bilaterally. No abnormalities with that. I'm going to check for CVA tenderness. So I'll place my hand under her left rib. I'm going to gently tap you, okay? If you have any pain, just let me know, okay? Any pain with that? No?
No.
Okay. Then we'll do the other side. Any pain? Alright, perfect. So now I'll go ahead and have you turn face towards the camera. Okay, this is where we normally do the breast exam. We would look for symmetry, we would look for size, symmetry, and any dimpling. We go in 3 different positions. We do arm above her head, we do arms at her hips with her shoulders rolled forward, and then leaning forward from the hips. Just like again, I'm looking for size, symmetry, and any kind of dimpling. Then we'll move on to the axillary nodes. So I have you lift your arm up for me. We're going to look for the infraclavicular. Feel for the. Tell me if you have any tenderness with this. Any tenderness at all? No apparent swelling. And we're going to look for the central node. Any pain with that? We'll look for the lateral node. Any pain or issues there? No signs of enlargement in either of those. And we're going to go to the subscapular. pain issues there, and then we'll go pectoral. Any pain issues there? There's also no enlargement there at all either. So that'll conclude our sitting portion